COVID panel. Good morning, and thank you all for joining us here this morning. Our government has a plan to improve health care for all Newfoundlanders and Labradorians. Budget 2023 saw the largest single investment in your health care ever in the history of the province. That shows that we're taking it serious. Significant changes takes time, and the solutions are quite complex, but this is all a part of a larger plan. And part of this continued change is why we are here today. As part of our ongoing commitment to increase access to health care in this province, we worked with the Newfoundland and Labrador Pharmacy Board to expand the scope of practice for pharmacists. These changes to regulations governing pharmacists in Newfoundland and Labrador are now in effect. Basically, these changes involve the ability of pharmacists to extend prescriptions to a maximum of 12 months, along with the ability to prescribe for 4 new ailments and conditions. They can also now prescribe hormonal contraception. With these additions, pharmacists are now able to assess and prescribe for a total of 33 ailments and conditions. These changes provide Newfoundlanders and Labradorians with more convenient options for how they access and receive health care. And it is particularly meaningful in more rural and remote areas of our province. Pharmacists have wanted to expand their scope of practice, and we've heard them loud and clear. We've heard from patients who have difficulty accessing care for simple ailments and conditions. I would like to thank Noelle Patton from the Newfoundland and Labrador Pharmacy Board, as well as Dr. Janice Adu, President of the Pharmacists Association of Newfoundland and Labrador, for their tremendous collaboration with us in making these changes a reality, not just for them, but for the patients they serve. I'll now ask Minister Osborne to say a few words.
Thank you, Premier. Allowing pharmacists to assess and prescribe for these select ailments and conditions, as well as enhancing their scope for prescription extensions, are additional measures which will help alleviate the demand on non-urgent services within our healthcare system. It is a positive step in addressing the challenges experienced by many individuals, especially those with no family physician. Pharmacists are well trained and play an important role in the provision of health services. In many circumstances, pharmacists have the knowledge and skills to safely assess and prescribe appropriate treatment options for individuals. Our work with the Pharmacy Board and the expansion of services will allow pharmacists to work more fully within their scope of practice and improve access to health care at the community level. We have also been working with the Pharmacists Association of Newfoundland and Labrador to ensure these expanded services are universally available to all residents of Newfoundland and Labrador and not limited to beneficiaries of the Newfoundland and Labrador prescription drug program. To that end, an investment of approximately $16.6 million is being made to support coverage of pharmacist fees to allow universal access to these expanded services at community pharmacies. As the Premier indicated, it is our government's hope that expanding the scope of practice for pharmacists in the province will help increase access to health services in a timely manner. I will now ask Noelle, Registrar of the Pharmacy Board, to say a few words.
Thank you, Minister Osborne, and good morning, everyone. As the regulator for pharmacy practice in the province, the Newfoundland and Labrador Pharmacy Board is dedicated to advancing the profession in the public's best interest and collaborating with the Government of Newfoundland and Labrador to do so. By enhancing pharmacists' prescriptive authority and empowering them to further use their specialized expertise to provide care, patients will benefit from additional and timely treatment options. The revisions to the regulations that I'll outline today are an important step forward in improving accessibility and continuity of care for patients. Premier Furey already outlined some of these changes. I'll review them briefly to clarify them for you again. Firstly, under the category of prescription extension, the regulations have been changed to reduce limitations to the quantity of medication that can be dispensed and the number of times a prescription can be extended. Going forward, pharmacists will be able to extend prescriptions for up to 1 year and will be able to dispense up to 90 days of medication at a time in cases where they feel is safe and appropriate to do so. Secondly, revisions have been made to expand the list of minor ailments or conditions that pharmacists can prescribe for to include conjunctivitis, commonly known as pink eye, fungal nail infections, shingles, and uncomplicated urinary tract infections. As mentioned, pharmacists will now be authorized to prescribe for a total of 33 ailments and conditions. Furthermore, pharmacists will now be able to be authorized to prescribe under 2 new prescribing categories, the first of these being hormonal contraception in varied formulations, and the second category enables pharmacists to support public health in preventing spread of infection through prescribing preventative medications to patients who've been exposed to an infectious condition. It's important to note that prescribing under this category will only take place under the referral from a regional medical officer or their designate. The Newfoundland and Labrador Pharmacy Board will support pharmacists in implementing these changes we have outlined here today to ensure patients are receiving quality care. An updated standards of practice for prescribing by pharmacists, which incorporates these revisions, will be available for pharmacy professionals on our website, nlpb.ca, this afternoon. Pharmacists currently authorized to prescribe by the board can use their professional judgment to begin prescribing under these amended regulations as soon as they've reviewed the regulation changes and the associated revised standards. As pharmacies work to implement these changes, people are advised to contact their local pharmacy to ensure these services are available and to ask whether an appointment is necessary before proceeding to the pharmacy. On behalf of NLPB, I'm excited to be part of this significant announcement this morning. Thank you, and I will now turn it back to Premier Furey.
Well, thanks so much, and we'll now ask Dr. Adu to say a few words. Doctor?
Good morning, everyone. I'm pleased to be here on behalf of the Pharmacists Association of Newfoundland and Labrador, or PANEL. In addition to being president of PANEL for the past 3 years, I'm also a community pharmacist in Corner Brook. And as a practicing pharmacist, I'm absolutely thrilled with today's announcement and extremely proud of PANEL's work in achieving expanded scope of practice and universal coverage for many pharmacist services. Today's announcement is a tremendous step forward in expanding the scope of practice for pharmacists in Newfoundland and Labrador while increasing equitable access to care through universal coverage for prescription extensions and other assessment fees for ailments and conditions. I'd like to speak first about our expanded scope. PANEL actively advocates that pharmacists in Newfoundland and Labrador be granted the full scope of their professional training. Our meetings with government officials, our public advocacy, our work with stakeholders such as the Newfoundland and Labrador Pharmacy Board, and our numerous submissions to Health Accord NL have resulted in expanded scope for pharmacists in Newfoundland and Labrador. This means that pharmacists in this province may now extend a prescription more than once, may prescribe and assess for new common conditions including conjunctivitis or pink eye, fungal nail infections, shingles, and uncomplicated urinary tract infections, which will go far in freeing up physician offices and emergency rooms. Today's additions bring the number of common conditions and ailments our pharmacists can assess and prescribe for to 33. These combined changes are important first steps in expanding services within the scope of practice for pharmacists and providing the building blocks that are needed for future expansion to services, such as additional primary care services being provided by pharmacists. Moving on to universal funding, we're delighted to see the universal funding announced for a number of pharmacy services, including those announced above. PANEL has been actively advocating for publicly funded services, specifically prescription extensions and assessment and prescribing of common conditions. This means that all residents of the province may access these services at a community pharmacy for free. While expanded scope combined with universal funding for pharmacy services is an extremely positive step forward towards increasing access to care for all Newfoundlanders and Labradorians, there's still work to be done. PANEL will continue to advocate for full scope of practice, including ordering and interpreting lab results and expanded independent prescribing privileges, along with universal funding for all common conditions and ailments that in pharmacy services. Thank you to department staff, Minister Osborne, Premier Furey, and the NL Pharmacy Board, and of course our members, in particular our committee volunteers, for their support in advancing our advocacy work. Our association looks forward to continuing to work work toward further expansion of scope of practice and related funding on behalf of our membership and all residents of the province. Before I conclude, I do need to stress that pharmacists are learning of these changes and developments today. So it's really important that patients understand that it will take time for these new services to become available in all pharmacies. Every pharmacy will be different regarding when they'll be ready to go. So please call ahead and be patient with your pharmacy staff and pharmacists as these new services are rolled out. Thank you.
Well, thank you, Doctor. We'll now open it up to questions from the media.
I want to ask about the public funding of this. How important was that in terms of increasing the uptake and in terms of diverting people away from emergency rooms, walk-in clinics, or already overstressed family doctors?
Yeah, that's a great question, Peter. Of course, the cost is assumed when the patient gets the condition, and what this does is allows us to deal with it in a cost-effective manner, and I think there's good evidence to support, especially around UTIs. When that can be treated outside the emergency department, it prevents a trip to the emergency department, which is probably the ultimate expense to the system, tying up nurses, tying up beds, tying up the emergency department, precluding other people from being seen. So funding itself is important, but you have to look at the whole scope of how the cost to the system. And this is a small piece to play, a small portion of that equation with respect to the cost of the system. We heard from the pharmacists that, of course, no one's going to provide services for free, so we think that this is a good balance with respect to the system cost and the individual cost, either per patient or as per the pharmacist's expense.
I just wondering if you could confirm the $8.2 million investment. What does that cover?
Well, I mean, perhaps, Minister, you could speak to this.
Yeah, absolutely. So in this year's budget, it's $8.2 million to allow us to ramp up and get pharmacists and pharmacies on board. Annualized, it's going to be $16.6 million. And that covers there was a number of assessments and ailments that were only covered through the NLPDP previously, will now be universal in terms of the coverage of the assessment. And the ability of pharmacists to prescribe beyond 90 days for up to 12 months will now be universally covered as well. So that's the $16.6 million on an annualized basis.
I just want to ask, as a community pharmacist, how big of a drawback was that extra cost for people who might normally have said, well, if I go to the emergency room, I can get it for free, but if I go see my pharmacist, I'm going to have to pay out of pocket?
The cost is huge. We're especially currently living through a lot of increase in cost of living, so people don't have a lot of extra money to pay for that service when they could go if they have the ability to, or they have to take time off work or away from their families to go sit in an emergency room to be treated for example, an uncomplicated urinary tract infection. So there are lots of times I've presented an option to patients as being able to do something for them, but there is an associated cost, and the decision is made to access that somewhere where it is covered for them so they don't have to pay out of pocket. So I think making it accessible, making it universal, because we've been allowed to do a lot of these things for a long time. We're talking about several new conditions added, but we're talking 33 conditions that we can prescribe, assess and prescribe for. So there's a lot of times when I say, I would be able to do this assessment for you, however, it's X amount of money, and people do decide to go access the emergency room instead because they don't have the extra money, because maybe they also have to pay out of pocket for the actual prescription, like the product. So I think this is going to be really great in preventing that from happening as well.
If I could add to that as well, I think it's important for a patient, the decision to get a urinary tract infection diagnosed and prescribed for by a physician can be done very quickly, as opposed to hours of wait in an emergency department. There are times that a patient will put that off as opposed to sitting in an emergency department, and the condition becomes even more complicated. So it's a benefit to the individual as well to get more timely access to services. It's a benefit by reducing a wait in the emergency department. And there are times that patients would simply just not go to an emergency department and wait. Now they have more timely access.
And of course, that opens up a slot to be seen by somebody else in the emergency department. If there's not 10 UTIs in the waiting room, then other cases can be seen, so.
You mentioned that this is going to benefit people who don't have a family doctor and will also free up doctor's appointments. Is the expectation that somebody who usually have conjunctivitis would go to a pharmacist, even if they have a family doctor? What's the thinking there?
No, not necessarily. This is optionality for patients. They can choose to, if they're in the pharmacy, be treated by the pharmacist for these ailments. There's no one suggesting that they don't go to their family doctor. Just this is an element of convenience. So we do know that primary care, although we're changing it in the province, is still difficult to access at times. But generally speaking, pharmacists are more accessible to patients for these simple ailments. So it's about optionality for patients who already have who have family doctors and also have pharmacists. It's not they have the choice.
Dr. Adu, could you speak to the importance of this hormonal contraceptives piece for pharmacists?
Yeah, that's what I'm really excited about. You know, we have a lot of people who I guess previously may not have felt the need to access a pharmacy or go to a pharmacy other than have their hormonal contraceptive filled, or you know, maybe they're having issues with it that they're not totally comfortable discussing with some professionals, or they have a close relationship with their pharmacist that they, you know, we might know a little bit more information or have a bit more, I guess, insight to the patient. We might notice, you know, you're really late on this refill. Should we chat about something, and maybe we can find a more convenient option for them or something like that. But I think just in general, this whole announcement just improves access to care for so many people that it's a great step.
You mentioned that you're already looking down the road at some future enhancements. What are you looking at in terms of the next round?
I don't think I have I guess we don't have a specific ask in terms of adding extra ailments or anything at this point. However, like I said, we can prescribe or assess and prescribe for 33 conditions, and only some are currently going to be universally funded. So seeing that open up and access would be really important. We've also asked a lot, if you've seen any of our involvement with Health Accord NL, a lot of requests for being involved in hypertension management and chronic disease management and being included in those type of care plans. So that's still on our radar. So those are things we'll keep asking for, but I don't want for that to kind of take away from how big this moment is for pharmacists and for patients and for government in Newfoundland now.
And it's a broader conversation about the transformations that are occurring with family care teams. This is not about the traditional silos of pharmacist versus nurse versus GP versus, you know, we are changing the culture of the practice of medicine in this province to be team-based. That's the way people are educated these days. That's what patients deserve. It's what providers deserve, and that's the ultimate goal of transformation within the healthcare system. It'll be more sustainable, it'll be more available, and it'll be what patients deserve at the end of the day.
And just to add to that, Peter, the Health Accord calls for an enhanced scope of practice for all of our health disciplines. This is one of those. We've been working with the registered nurses, the practical nurses, with physicians. For example, we've got a very good relationship with the regulatory body here, as well as the association. We'll continue to look at, into the future and continue working with both the regulatory body and the association as we make improvements to the healthcare system.
You mentioned that only some of these are going to be publicly funded. Which ones are and which ones aren't?
So there's, like I said, a list of 33 ailments. So right now the ones that will be covered are pink eye, fungal nail infections, shingles, uncomplicated UTI, hormonal contraception. Those are the new additions. But we've been able to prescribe and assess for others. And so the ones that already exist are gastroesophageal reflux disease, or GERD, hemorrhoids, nicotine dependence, cold sores, and fungal skin infections. So those are things we've already been able to do, but now there's funding in place for people to be able to access them. So the list is quite broad for what we can do, but only this group is going to be, publicly funded for now.
From a systems perspective, urinary tract infections are one of the most common reasons to visit a doctor or an emergency department. So the more people treating the uncomplicated ones, the better. It prevents the complications from occurring in the first place. It opens up spots in the emergency department. It gets rid of the lost opportunity costs for visits for other patients. So this is about that sole entity, that sole condition and disease is incredibly important moving forward from a systems perspective and for a patient convenience perspective as an individual.
So Peter, there are 4 new ailments that are now universally covered. There are 5 that were previously covered only by NLPDP, so somebody with a provincial drug plan card, for example, those 5 will now also be universally covered in terms of assessment.
Why not cover all the conditions that they can prescribe for? Why only the limited list?
I think, this is a good news story today. We've got 9 new additions that are universally covered. The most common that would be requested of a pharmacist, and this is a huge move forward, not only for the province, for the regulatory body, the association, but for the people of Newfoundland and Labrador.
I'd like to speak to that as well. From a pharmacist and practicing in community setting, to go from not that you can't, but not being able to bill for these and not being able to, no longer charging your patients for these assessments. This is going to take time for pharmacists to get used to as well. So I think to go from nothing to having every single thing, it would cause potentially some confusion and stuff. I think giving people a concrete list to now to work from and be comfortable with, and then maybe further expand that might ease with the transition as well.
We got time for one more questions or anything else?
I got a question. It's actually not about this, but it is in the same field. We're hearing a lot of reports of a lot of strep throat infections running around, and also a shortage of antibiotics to treat the strep throat. Is there a shortage of antibiotics in the province, and if so, what's causing it? Is it more strep than normal, or is there something else going on, supply chain issues?
So the Pharmacy Association could probably speak to this as well.
I mean, I can speak to it a bit too. My wife works in the Janeway Emergency Department. I mean, this is a normal kind of thing that happens at this time of year. There's a combination of things happening this particular year where people are stopping using masks to a certain extent, and so some of the more kind of communicable diseases that humans have been familiar with for forever are starting but had been depressed during the pandemic, are now starting to become more common. And time will tell if they're actually more common, or we're just seeing them as more common because we were used to not seeing them as much in the past 2 or 3 years with masks and social distancing and things. So there's not a particularly more virulent strain of streptococcus that I'm aware of that's causing the strep infections. There has been issues with antibiotic supply chain and supply in the past, largely related to supply chain issues coming out of the pandemic. They were global in nature. My understanding is most of that has been rectified to date.
We're at no immediate risk.
Yeah.
Yeah, a lot of that is kind of settled out. There is some, hit and miss with some antibiotics, but there's always an option. So, I don't want to create any public perception that they can't get the antibiotic that they need. Pharmacists deal with drug shortages all the time, and we're very creative, and we will find a solution if we need to.
Most of the strep throats can be treated with very simple antibiotics that are readily available, so there's no need for the public to panic in any way.
Okay, thank you.
Thanks, folks.
Great.